Surgeon Schmidt, just checking on you.
How are you?
I'm doing great. How are you feeling?
I'm feeling good, thank
Great.
you.
Yeah, you look great. You look alert, oriented, and just gonna do a few assessments.
Okay.
Check your wristband. No bruising. And is your central catheter staying in place pretty well? Not
Yeah.
giving you any complications?
No, none at all.
I just need to check the date. Today's the 16th, correct?
Yes, sir.
It says November 12th. Nurse!
Yes, doctor?
Please tell me that you just forgot to put a new date on.
We were actually going to change her dressing today, so.
Today?
Yes.
Okay, so yeah, you're running right on the deadline.
Okay, we'll change it
Should
right
be
away.
changed every 3 or 4 days to
All right.
prevent infection.
All right, we'll change it right away, doctor.
All right, thank you.
Okay, Maria, since you are a nursing assistant, can you gather my supplies so I can change her dressing?
Okay, no
I'll
problem.
need a central line dressing change. I'll need 2 masks, one for myself, one for the patient. Go ahead and give me 2 pairs of sterile gloves and a gown and gloves, extra gloves, okay?
All right, sounds good. Personal protective equipment, 2 sterile gloves. Have your stuff, nurse.
Nurse Jaime, what's the first thing that we should do before we start changing her dressing?
The first thing that we should do before we change our dressing is always wash our hands. That's the first line of defense against infection. So let's go ahead and wash our hands. We'll wash them for 30 seconds, or we can sing the happy birthday song twice.
Okay.
Oh, you can sing happy birthday to me.
Yes, we
Yes,
will.
we will.
Okay.
Happy birthday to you. Happy birthday to you.
Nurse Jaime, why is it that you're wearing all that but I'm not?
We usually wear protective equipment like this if you're in contact with the patient. Since you'll just be standing at her side, you won't need to wear it.
Okay.
Okay? Okay, Christy, we're gonna change your dressing today. Are you feeling okay?
I'm feeling fine. Is this gonna hurt?
You're gonna feel a little tug on the line. I'm not gonna pull too hard because I don't want to pull it out. You're just gonna feel a little discomfort. I'm gonna try to make it as painless as possible.
Okay, thank you.
Last dressing off, and I'm gonna change it. I'm gonna clean it with chlorhexidine.
Nurse Jaime, why are we using chlorhexidine to clean?
According to evidence-based practice, chlorhexidine is the method of choice.
Okay.
Okay, Christy, we're gonna start cleaning your line, okay? I'm gonna start at the middle part, work my way out, and then I'll clean the lumens.
Okay.
So I have 3 swabs here. The first one is gonna be at the site. Next is gonna be the lumens. Roxanne, do you have any questions?
Why is it that you needed to have 3 swabs? Couldn't you just use 1 for the entire thing?
Well, if I use 3, it's a greater amount of protection against infection. So 1 will be for the site itself, and then each for the next lumens, so we don't contaminate it. All right, now we're going to put the dressing on. You want to make sure that you cover the dressing completely, leaving the lumens exposed. And before placing the dressing, it's always good to allow it to dry. So we allow 30 seconds for it to dry. We'll remove it. And every single one of the kits is always going to have a label label to date. We always put the date and the time that we placed it. So that 3 days later, we'll have to change it again. And that's to remind her next nurse to change it after 3 days.
Okay. So Nurse Jaime, what should I be looking for when I come back to check on the patient to see if she has an infection?
Well, we're always gonna monitor her temperature. We don't want her temperature to go up. We don't want her to have a fever. And we're gonna monitor the site for any redness, any drainage, any pain or tenderness around the site, Miss Christie, okay?
I feel fine, thank you.
You feel fine right now? Do you have any more questions?
No, I think this will be great information to use for my evidence-based project that I have to do for Miss Wells' class at Del Mar College.
Well, that's good.
Yeah.